Good evening, everyone. Welcome to Agora, an open platform to share insights, knowledge, and experiences beyond all borders. Today, we are honored to host Dr. Alaa Zeineldin. He is senior consultant obstetrician and gynecologist. He graduated from Alexandria University and then continued in France, where he specialized in minimal invasive surgeries and fetal-maternal medicine at René Descartes University. Today, he will share with us his thoughts on a challenging and timeless topic, which is pain. So his multidimensional approach will take us from history to medicine, exploring philosophical insights and contemporary debates in ethics. So during this presentation, we will discover or rediscover the notion of pain through different historical eras and different disciplines. So Dr. Alaa, thank you so much for being with us tonight. Always, we will start with a 30 minutes presentation and we will open the talk for questions, comments, and discussions. Thank you so much.
Thank you, Nevyne, for your presentation. And actually, I would like to thank Art Concept in Agora, presented by yourself and Jihan Saleh, for the great effort that I have witnessed myself in the creation of such projects and the cultural idea behind. I would like to thank everyone of the audience for being here tonight. Of course, the subject that has been chosen is not an easy one. Very vast, and believe me that it is so painful when you dig behind all aspects of talks about pain. Every human being has experienced pain. However, it's often difficult to describe the feeling of the painful phenomenon, to give a precise definition or to explain the cause of the pain. The expression of the experience of pain is closely linked to the conception of the painful fact. However, this has evolved over the course of history, and many historians attribute the struggle against evil to the birth of clinical practice. Practitioners are no exception to this situation. Most failures are due to lack of understanding of the phenomenon of pain. Pain is both universal and a totally intimate phenomenon. Defining pain remains a complex exercise faced by philosophers, poets, religions, and empirical medicine before it became the object of science and then of public health. I took the challenge to tackle the concept of pain through different angles, but this presentation will only give a hint of all that exists. I will mention physicians and philosophers who have transformed the understanding of pain throughout the centuries. Then I will focus on modern medicine, its progress and ongoing problematics. Actually, I couldn't find a stronger start than these two quotes about pain. According to Jean-Bertrand Pontalis, a French philosopher, writer, and psychoanalyst, lived in the 20th century, who said, through the journey of life, from its very beginning to its extreme end, pain remains as faithful a companion of the body and psyche, a pure experience, unthinkable and unspeakable fact. And the saying of Cicero, who is considered as one of the most famous bodies of historical and philosophical work in all of classical antiquity, who said, "The pleasure that we hold for the supreme pleasure is that of which we are witnessing the elimination of all pain." Since the beginning of humanity, the thinking man tried to understand the pain. Philosophers over all times have tried to contribute to a better conceptualization of pain and suffering. Pain can be described in neurological terms, but also by cognitive awarenesses, interpretation, behavioral dispositions, as well as cultural and educational factors have a decisive influence on pain perception. Surprisingly, Aristotle didn't include a sense of pain when he enumerated the five senses. He, like Plato before him, saw pain and pleasure not as sensations but as emotions, passions of the soul. Hippocrates believed that pain was caused by an imbalance in the vital fluids of a human. At this time, neither Aristotle or Hippocrates believed that the brain had any role to play in pain processing, but rather the heart was considered as the central organ for the sensation of pain. Galen of Bergamo is one of the greatest authorities in medicine after the great contribution of Hippocrates in the foundation of the scientific medicine in classic Greek era. Galen contributed substantially in shaping the profile of modern medicine. He didn't refuse to treat patients he considered had a terminal illness and argued that accurate prognosis could protect physicians from accusations of incompetence. For him, the pain was considered as only four types: weighty pain, stretching pain, pulsating pain, and lancinating pain. About 900 years later, Ibn Sina, Avicenna, wrote the Canon of Medicine, which has transformed many concepts in medicine and has inspired physicians for centuries. He challenged Galen's concept of pain, that it was always originated of injuries. He suggested that the true pain was a change of the physical condition of the organ, whether there was an injury present or not. Avicenna actually extended in his Canon Galen's descriptions of 4 types of pain to 15 types. And such classification is still valid in the actual modern medicine. Those 15 types are the tiredness, heaviness, pulsating pain, stabbing pain, soft pain, coarse pain, stretching pain, breaking, itching, pricking, penetrating, compressing pain, numbing, bitter pain, or disintegrating pain. So he explained the difference between 2 words that we use until now, waja and alam. Waja was a general name for pain, and alam used to describe how the patient feels. About 100 years later, on the other side of the Islamic world at that time, Ibn Rushd Averroes appeared in Andalusia and had observed a direct relationship between the brain and the nerves. And the brain and nerves that control the extremities. He claimed that the brain is only a general who commands his troops, but it is subordinate to the king, who issues the appropriate commands, that king, the monarch, being the heart. He reached this conclusion on the basis of the theory of the heat of the heart and the cold of the brain, a theory that derives from the ancient Greeks. From Persia and Russia, the journey continues to France, where René Descartes in 1644 published his book, Principles of Philosophy, in which he explained that pain was felt in the brain, not the phantom limb. His concept was that the soul of the pain was located in the pineal gland in the brain. For those who will ask what is the idea of phantom limb, the phantom limb syndrome is the feeling of a sensation in a limb that has been removed. There may be feelings in the limb as if it were still attached to the body. This is because the brain continues to get messages from nerves that used to feel for the missing limb. So he argued that the persistent agitation of the nerves from the phantom limb produced sensations as if the phantom limb was still intact, and this was different from the learning of church at that time. Church thinking considered pain closely linked to original sin. He believed the pain from the phantom limb was real and not imaginary. It is generally believed that Descartes used the notion of the soul to avoid trouble with the church, being well aware of what had happened previously to Galileo before him. 14 years later, actually, after his death, the book named L'Homme, means the man, was published. And again, fear of the reaction of the church to what was in that book, he didn't publish it during his life. He confirmed in that book his theory, presenting a model of pain in the form of a boy sticking his foot in a fire. Then the painful stimulus resulted in the pulling of a delicate thread that connects the boy's leg to the brain by the shortest route. This early concept of pain transmission actually formed the basis of further modifications of pain theories in the 19th century. This theory moved the center of pain sensation and perception from the heart to the brain. Descartes proposed another example by presenting an image of a man's hand being struck by a hammer. In between the hand and the brain, he described a hollow tube with a cord beginning at the hand and ending at a bell located in the brain. The blow of the hammer would induce pain in the hand, which would pull the cord in the hand and cause the bell located in the brain to ring, indicating that the brain had received the painful message. Of course, philosophers have always discussed pain and suffering and brought new understandings about it. It would need hours to go through them all, from the antique schools of philosophy, the Persian and the Andalutian writings of the Middle Ages, the humanists of the Renaissance, to Schopenhauer's pessimism that led to Nietzsche's intellectual objections. In 1882, Friedrich Nietzsche declared, "I have given a name to my pain, and I call it dog. It is just faithful, just as obtrusive and shameless, just as entertaining, just as clever as any other dog." In Nietzsche's philosophy, the concept of pain and suffering is overwhelming, and in few words, we can say that to him, the eternal return of the pain should be accepted and embraced as it is the only element that nourishes our willpower and that makes us excel to become an ascending human rather than a declining one.